and welcome back to this episode of this Healthy Life podcast. Very excited for my guest today. He's going to be sharing an amazing tool that not many people know about. I've got Dr. Adam Gavine here, and he is a chiropractor with 18 years of experience. He's got a deep passion for sports rehab and soft tissue repair, and he is also the co-founder and chief medical officer at Wasabi Method. And so very excited for you to be on today and share your experience and share with us this amazing tool that you've been working on. So welcome.
Thanks, Erica. It's a pleasure to be here.
Amazing. So I'd love for you to start just kind of with a brief intro about yourself and how you got into this space and starting the Wasabi Method.
Yeah, so that's a great question. It's a bit of a story. So I live and work in Sydney, Australia, and in 2010 I worked for another practitioner, and he introduced me to Shockwave, which I'd never heard or seen before. And he said he was getting really good results with it, and it was very effective. Because throughout my education, we'd been exposed to different modalities, electro therapy devices, but I've never seen anything that was, kind of blew me away. I was like, oh, this helps a little bit and whatnot. And usually they're expensive too. So there's always that apprehension of like, are they just trying to, take my money and sell me something that's really not going to move the needle for a lot of my patients. But this one, it was different. I started using it, and my clients and patients I was noticing big changes, particularly with like tendons. Tendons are hard to treat because they have a very poor blood flow. So one of the main things that this device does is it increases blood flow, but it does so in a permanent manner to the tendon. So I thought I was pretty good with tendons before, but as soon as I started using this device, I was like, oh my God, I'm getting way better results. So that really opened my eyes. And then the salesperson that had sold the device to my boss, he asked me, he was Canadian, and, when Canadians are abroad, we all kind of congregate together. And he was like, do you want to learn more about this device and become an instructor? And I was like, oh, that sounds cool. So I went to an instructor seminar in Malaysia and became a certified instructor for one of the biggest shockwave therapy companies in the world. And yeah, the rest is kind of history after that.
Awesome. So I think there's probably a lot of listeners out there wondering, what is Shockwave? And it sounds like a little intense, right? It sounds like you're going to be shocked or electrocuted and have these waves going through you. But can you break down exactly kind of what it is, how the technology works, and some of the applications that you can use it for?
Yeah, most definitely. It's as the name says.
It sounds like it's an intense name, right?
Back to like the 30s and 40s when they did like electro.
Exactly. Absolutely. I don't want people to get the wrong idea.
Yeah, they could have come up with a better name, but that's what they came up with. So they're acoustic sound waves. So a shock wave, by definition, is it's a sharp rise to a peak pressure, and then it drops below ambient pressure, and that causes like this. There's two phases. So the positive phase is called the compression phase, and the negative phase is called the tensile phase. And then this causes these little cavitation bubbles to form. And the belief, it hasn't been 100% proven, is that these cavitation bubbles stimulate the body to release certain growth factors and proteins and enzymes and stuff like that. And so I tell people, it's like me going, okay, clean up on aisle 5. So you can have an old injury here that our body doesn't do a great job of fully healing things. Like if you tore a muscle in, like, say, your bicep or something, your body will clean it up good enough that it'll work, but it's never like what it was before. So even if you tore your bicep, 20 years ago, I can go in there and stimulate your body. I'll be like, hey, I want you to actually finish the job here now. I want you to clean this up. And it'll stimulate all these reparative and healing processes in your body. It actually causes a little bit of inflammation, but an acute inflammation, which is necessary for healing. So that's the gist of it. Another analogy I like to use, it'd be like if you stood in front of a big gong and someone hit it, you would feel those sound waves hit you. That's essentially what we're doing. So it's like a gun. There's a guiding tube. There's a bullet inside. There's compressed air that pushes the bullet. It hits the tip, which is basically a gong on the end. It sounds the acoustic sound waves into the tissue, and then it causes the healing and the repair.
Very cool. It's crazy that even just sound can go in and do repair in our body, right? I mean, that's really kind of the
Yeah.
gist of it. So
Yeah.
the Wasabi method is a type of shockwave. So how is that different from, say, like traditional shockwave, and what makes your product stand out compared to others?
Well, ours, we have to stipulate that ours is a radio wave, a radio pressure wave. So the definition of a shock wave, again, it has to be supersonic. So ours is subsonic, so it doesn't go faster than the speed of sound. Therefore, we have to say radio pressure wave. But in terms of physiology, there is a sweet spot in terms of energy that you input into the body. As long as you're in that range, it's going to cause these physiological changes. So a lot of people get hung up on the semantics. They're like, "Oh, it's not a true shock wave," and I'm like, "Well, it still does the same thing." You know, so I tell people don't get hung up on whether it's a true shock wave, because the research shows it doesn't really matter to a degree. Obviously, if you go too low energy, it doesn't do anything. But by contrast, if you actually go too high energy, it actually causes destruction. So the first application of shockwave was for treating kidney stones. It's a process called lithotripsy. So that's how they first used shockwave, was to break up kidney stones. So,
And when was this developed? How long have we had shockwave as a therapeutic?
so lithotripsy's been around in humans since 1980.
Okay.
And they actually started using it on dogs and stuff in the late 70s. And then they tried it on the first human trials were in the 1980 in Germany. What they noticed after that was some of these people that were there breaking up their kidney stones is because it's near the pelvis. And it was causing these changes in these people's bones, like a beneficial effect. And they were like, "Oh, that's interesting." So then they started using it on bones, and it would help with like osteopenia or fractures. So people would help their bone density, and it would increase what are called osteoblasts. So there's two types of bone cells. One's called an osteoblast, which basically makes new bone, and then you have what are called osteoclasts, and they break down bone because bones are cells like anything in our body. And after a certain amount of time, you need to get rid of the old ones and replace them with new ones. So what this device does is it increases the osteoblastic activity, and it decreases the osteoclastic activity, which is what we want if someone has a bone that's fractured, or if they have osteoporosis or osteopenia, because they've actually gone the other way. If they have osteoporosis, is the osteoclastic activity is outweighing the osteoblastic activity, and then that's why they keep losing bone.
Interesting. So you mentioned a couple of applications now. So it can help with bones, it can help with tendons. What are some other uses that this therapy can be used for healing in people?
There's a ton.
Everything.
I'll just go over a few.
Yeah.
So one of the main ones, obviously, like I said, is the tendons, but muscles is a big one. So anyone that has like trigger points, knots in their muscles, it's really effective for helping that. Other things it can help with is a lot of people want to use it for aesthetics. So you can actually use it for things like scars, so surgical scars. It'll help that heal, and so that you have less of a scar. It will actually have a practitioner I know, he'll use it on an area before people go in for surgery, so that the scar heals much faster. You can do it pre-operatively, because again, we're increasing the angiogenesis in the area, which is the new formation of blood vessels, which is a permanent effect. So a lot of spots in our body, we don't have optimal blood flow to. So with this device, we can change that. We're telling the body, lay down some more capillaries and blood flow in this area. Another one is like cellulite. It can help with cellulite. It actually causes what we call lipolysis, so it causes the breakdown of fat to a degree. It causes increase in collagen, so that's why it helps with a lot of skin things. It causes the proliferation of endogenous stem cells as well, mesenchymal stem cells. So that has applications for lots of healing and regenerative processes. But another one is men's and women's sexual health. So particularly with men's erectile dysfunction, because again, it helps with the angiogenesis. It also causes the release of nitric oxide, which causes vasodilation of arteries and blood vessels. So that's very effective if you have a specific type of erectile dysfunction, which is vascular. So again, we're causing a permanent change to the area. Whereas if you go and you take like a Viagra or something, as soon as that drug's out of your system, the effects
back
are
to
gone.
where you were.
Whereas this, and you got to take it over and over and over. Whereas this, they've shown that doing as low as 6 treatments has quite good clinical effects for a lot of these men, specifically if you have the type of erectile dysfunction, which is subcategorized as vascular.
Mm-hmm. Yeah, that leads into one of my next questions. I was going to say, like, ask how many sessions does it usually take to notice a difference? So say you're working on like a tendon area or like a muscle pain, like, is it a series of 6 and then you're in a pretty good place, or do you have to continue to do more, like a maintenance plan to kind of keep up with it? Or what's kind of the general program, if you will, or plan when you're using it?
Yeah, great question. It depends
on what you're dealing with, right?
Yeah.
It always comes down to
one of my mentors is Stuart McGill, and whenever I listen to him, he's always like, he answers every question with "it depends."
So many variables and everything.
It depends on the condition. Depends how long they've had it. Depends how healthy they are. All these things come into play. But generally, if I treat let's give an example. It's a 25-year-old semi-professional, golfer or something. They have golfer's elbow. Before they actually start feeling or noticing changes, it might take as little as 3 treatments. Okay. The cool thing about the treatment as well is it's like when you put fertilizer on your lawn, it doesn't just work that day. It works the next day, the next week, the next month. So they've shown in clinical studies that doing even just one treatment had physiological changes up to 3 months later. So we're telling the body to make all these growth factors and enzymes and proteins, and they are like fertilizer in the body. They tell the body, keep working on this area, keep regenerating it, keep renewing those tissues and causing tissue repair. So that's one example. But for like erectile dysfunction, the standard protocol is 6 treatments once a week. They've just updated that last year. They recommend 6 follow-up treatments at once a month they got better results. So they did a study where they had one group just do the 6 treatments. The other group do the 6 treatments and then 6 follow-up treatents, and the group that did the 6 follow-up had
better results.
Much.
Yeah. And then after that kind of maintenance period, like once you feel like you've had relief, a lot of people, does that pain kind of come back? Like say that like tendon, like inflammation and pain, does it come back? Or once you've kind of given it those tools to heal, does it kind of resolve itself and you're not really going to be dealing with kind of that old injury? Because I have an old tennis elbow injury that I, fell, kind of put my hand out and my whole like elbow twisted in. And I mean, gosh, this happened probably almost 20 years ago, and it still haunts me to this day. I'll still be working out in the gym and still have like kind of like those pops and crackles and just irritation with it. And, I've done acupuncture and things like that, and that did help a little bit, but I feel like that's kind of just like a Band-Aid. It helps for a little bit and it comes back. So I'd be super interested to try a series of Shockwave or like Wasabi Method, they're like treatments on that to see if it can finally resolve and not have to kind of always be reminded of it, you know?
Yeah, that's a great example, Erica. Again, if we go back to how tendons have poor blood supply, so when you damage it or have an injury, you're restricting that blood flow even more. And that's not going to change. Again, what I was alluding to, where the body does a good enough job, they'll be like, yeah,
It's good
that's good
enough.
enough
Move on
kind
to
of thing.
something else.
Yeah, exactly. We got bigger fish to fry kind of thing. But with our device, it's going to go in there and change the physiology. So even if you had it 20 years ago, we can still, because the cells in your body, the oldest cell in our entire body is only 7 years old. So every 7 years, your body regrows every cell in your body. So we can make the next generation of cells stronger and more resilient than the previous.
So the Wasabi Method is making this treatment a lot more accessible to people. So if people are seeking out, you know, shockwave therapy or Wasabi, like what's the best way to go about getting it? Is this something that people can do in their home, or do they need to work with a practitioner to use the tool?
We have two options. So you can purchase it as a non-medical person. The caveat there is you can only treat yourself. We don't want people, there are some contraindications. So, but what we do for that, before I'll even say, so say you wanted to buy a device, Erica, you would pay me for the device, and then I would send you our safety module, which you have to pass. You have to get 100% on before I'll send it to you. So if you don't pass that test, we had one guy, it took him like months.
Oh my gosh.
I think he tried it once and was like, "Oh, I can't be bothered." And then, dude, I can't send it to you unless you pass this.
Is it a hard
So he finally
test?
said, well, it's not that hard,
Just have to
but
actually pay attention, right?
yeah, you got to pay attention. You can't just be like click, 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 click kind of thing. And that's on purpose, because I don't want you to harm yourself or others. So we can do that. A lot of other companies, the company I used to work for, they will not sell their device to non-medical. Even though they can. It's in the United States, it's a class 1 FDA device. So it's basically categorized as a massage device. It's not anywhere else in the world. Like I live and work in Australia, and we call it Shockwave here. But you can also purchase it as a medical professional and use in your clinic, and that's probably our main sales come from practitioners, mainly because practitioners can make more money if they have our device.
And have more people that can use it as well, I'm assuming.
Yeah, and they can have, like, you could have one in your clinic and have 4 or 5 practitioners using the device. So if you have if you're a chiropractic clinic, for instance, you might have a massage therapist or a podiatrist that work in your clinic. They can use it for treating conditions as well.
And then you mentioned that there's some contraindications for it. So what are those, and what are things that people need to look out for to know if they're a good candidate for this treatment or not?
Yeah, there's a few standard ones, like you shouldn't treat kids, and that's because it causes changes to the bone, and their growth plates haven't finished changing. So that's one of them. So under 18, pregnant women, it's not because it's been deemed harmful. It's just because we haven't done studies to show that it's 100% safe. If you've had a cortisone injection, there's a caveat there. So if you've had like a cortisone injection in your left shoulder, I can work other parts of your body. I just can't work that left shoulder until 6 weeks later.
And what is that? What is that connection with the cortisone that makes that a contraindication?
So with the cortisone, it has it's a anti-inflammatory, so it's going to numb the pain in the area, and we rely on some biofeedback, because the treatment itself is it's not painful, but it's not without pain. Let's say so. It's uncomfortable, and we can control how intense it is. So usually I try to keep it under a 7 out of 10 on someone's pain scale. All right. If they're only saying, oh, that's a 2, I try and turn it up. There's a sweet spot between about 4 and 7 where it's going to have the greatest physiological effect.
Gotcha. And then I'm
But
sure
we always do it based on the patient's pain threshold.
So you recommend that people do 6 sessions in a row for more or less most conditions, is that right? And then is it something that you kind of stay at the same level each time and each week kind of crank it up a little bit to see if that improves their reaction to it? Or is it something that during a session you try to take them up a little bit higher to work within that threshold of pain that they're feeling?
Yeah, we try and turn it up a little bit during the session if the patient
Can
can
tolerate
it.
it,
And
yeah.
that's because the research has shown if we have more energy going into the system, it causes greater physiological changes. So I make people aware of that instead of just thinking I'm a sadist or something.
Mad scientist.
Yeah, they're like, you just trying to hurt me, and I'm like, no, I'm trying to
You're like,
get
this
you
is
the
going to heal
most.
you, I swear.
Yeah,
Amazing. And then what sorts of,
but going,
oh, go ahead, sorry.
going back to what you were saying about the 6 visits, it's that was for erectile dysfunction.
Gotcha. Okay, so it just depends on the condition.
Yeah, some conditions may require more. So if you have a chronic tendon, like I had one lady, it took me 12 visits before we got her right. But some people, it takes less. I've had some people 1 or 2 treatments and it changed them. So that's why I was saying that the answer to that question is it depends. Really dependent on the condition, the patient, how healthy they are, whether they have other comorbidities, other things like that.
Probably how long they've been dealing with the injury as well, too, right? Like how old it is.
Yeah,
Yeah,
yeah.
absolutely. And then, so what sort of like stacks can you do with it? So, I'm sure that this is going to be helping kind of like your tendons. Does this get supported with like, certain exercises or chiropractic care, or are there certain supplements you can be taking as well to enhance the results of your experience with the Shockwave? Or is this pretty good as a standalone therapy on its own?
Yeah, great question. I almost never use it as a standalone. It's and partially because the literature just shows anytime when you combine it with other modalities, it's always better. So whether it's exercise or photo biomodulation, which like light therapy, yeah, supplements, nutritional therapy, all these things. So I come at it from all angles. Like I tell people, the more things we kind of throw at it, the more things will probably stick. So, and as long as it's not interfering, they're not interfering with each other. Like I had a high powered laser. Some people, when I would use it on, like I had a lady, for instance, she couldn't tolerate it on her foot because she had plantar fasciitis, even when I had it on the lowest setting. So what I would do with her is I would use the laser on her foot first because that would cause a little bit of an analgesic effect. It's different from when we're talking about like when you have a cortisone or if you take anti-inflammatories because it's a natural, I'm stimulating your body to release these natural chemicals that have an analgesic effect. And that's way different than giving you an exogenous form of anti-inflammatory. So after about 5 minutes after the laser, it would settle down her pain enough that she could tolerate it on the lowest setting, and then I could get in there and work on it. But the other really good thing about that is, in terms of physiology, they're working on 2 different pathways. So the laser was working on what's called the COX-2 pathway, which is what like Advil and anti-inflammatories work on, whereas the radial pressure wave, or the Wasabi, works on the neurogenic inflammation, which is a different pathway. So it's cool that you can hit it from both ends, and then they have a synergistic effect.
Yeah, yeah, it's always good to kind of combine therapies and get the most repair and reduction in
Yeah.
symptoms as possible, right?
Well, and compared to invasive procedures, the side effects or adverse effects are really minimal. Like we were talking before about contraindications, that it's it's really hard to harm someone with this device, and it's been used for over 30 years. So there's every study I look at, like when it goes to adverse effects, it's like none,
Nothing.
none, none.
Yeah.
Like I keep seeing none, or like the worst thing that'll happen is someone will have a bit of a bruise, or they'll have a little inflammation
Mm-hmm.
in the area,
Mm-hmm.
or a bit of soreness, which is like compared to most drugs, you look and there's like a
Right.
page long
Yeah, I was just gonna
thing of
say,
side
like, I mean, this is at least working to kind of heal your body and repair the damage versus like, like getting a cortisone shot or even PRP. All those things are just band-aids that are kind of like numbing and masking the pain and the injury, but not really doing anything to heal it. And probably over time, those injuries are just continuing to get worse as it is, because you're not really doing anything to repair that part of your body.
Well, for to elaborate on that, cortisone, one of the side effects is it erodes what's called the enthesis, which is the part of the tendon that attaches on the bone. So they showed when people were having 3 cortisone injections within 1 year, it increased their risk of rupture 10 times. So they actually banned people from getting their Achilles, in Australia at least, because people were getting cortisone injections and then they were running around because they're no longer feeling pain. They were running and jumping and doing things. They were overloading it, and then their Achilles would snap. And then they had to have surgery to repair it now. So it's like, oh, thanks, doc, for, make me not feel pain. And then now I have, and unfortunately, when you have Achilles tendon rupture, which is probably in the news now a lot because Tiger Woods just did his, it takes about 12 months to recover
Wow.
from that before you can play. Like if any professional athlete ruptures their Achilles, it takes 12 months before they can play again.
And does Shockwave help with ruptured tendons, or is it just only surgery and time that can heal with that? Okay.
No, 100%, because it causes the proliferation of what are called tenocytes, which are tendon cells that regrow the collagen fibers that connect everything. It also causes the proliferation of a glycoprotein called lubricin, which helps lubricate the tendon so it slides and moves much better. So that helps a lot with these overuse injuries. But there's a famous practitioner in Australia named Jill Cook, who is pretty much the smartest person in the world on tendons. And she always says healthy tendons never tear. So if someone's ruptured a tendon, it had to be
something going on before.
Something wrong with it.
Yeah.
Usually for a long period of time.
Gotcha.
The problem can be it might not be painful, and then the first sign is when you tear it or rupture it. Yeah.
I've got a little bit of a curveball question for you, and I'm not sure if you're even familiar with this topic, but there's a lot of people that have I think it's a genetic, is a kind of like the baseline of it, but if they take Cipro, they get floxed and they have tendon rupture from taking Cipro. And so this happened to my mom, so that's why I'm quite familiar with it. Is this something that could help repair the tendons in this kind of use case as well, if it was due to some sort of medication that caused a rupture and the tendons need to heal? Is this something that could be used in that application, or is this better suited for something that was an injury or some sort of like fall or injury to the tendons?
I'm not aware what Cipro is.
Oh, it's a fluoroquinolone antibiotic. So the condition it causes, they call it floxed because it was from the fluoroquinolones, and so it causes your tendons to rupture from taking the antibiotic because your body's not able to process the antibiotic.
Yes. Okay, I've read about this. Yeah, it increases. That's one of the side effects of the. I think they're called hydroxyquinolone family. It increases your risk of tendon rupture.
Yeah, so I'm curious if this would be a good application to help that demographic of people that are struggling, because those people go to their doctor and they're just like, oh, sorry, it was a side effect from your medication. There's nothing I can do for you. And, I wonder if this is something that can help kind of repair that. No.
Yeah. So I don't have any specific clinical evidence for that, but I would suggest it would be helpful.
Yeah, I'm curious.
Again, we're stimulating all these things are natural. It's a non-invasive technique. So I'm just telling your body, make more of the good things that will help this repair and heal. So I couldn't imagine there would be any contraindications. That I've never seen it on a list of contraindications. Yeah, so I would be interested to see what it could do.
Yeah, if you come across anything, let me know. I'm super curious about
Yeah,
that. Figured I'd throw
yeah,
the curveball at you.
I'm literally looking at studies. Like I was reading some right before bed last night.
It's
Yeah,
funny. So we've got time for
yeah.
one more question. So it sounds like you've been using this tool for quite a while now and been involved in this world. What's kind of one or two success stories that stick out in your mind that you've seen just kind of be an amazing transformation and healing recovery story using this tool?
Oh, okay. You put me on the spot now.
The last question didn't get you, but this one did.
Yeah, you had to get me with something. Let's. There's one that always sticks out. I had a patient. She was about 65. She had really bad plantar fasciitis. She had seen approximately 10 different practitioners over 2 years, and she said she spent over $10,000 in those 2 years, and she really wasn't any better. The funny thing is, I'm a chiropractor. I'm a sports chiropractor, so I do a lot of athletes and different things. She'd actually been harmed by a chiropractor like 20 years before, so she pretty much swore off chiropractors. The only reason she came to see me was because I was working for an orthopedic surgeon at the time. And he said to her, go see Adam, he'll help you. And that was the only reason, because she trusted him. Because he's like one of the best orthopedic surgeons in Australia. Mm-hmm. So she was like, okay, if he says he's good,
I'm going to go.
Trust him. Yeah. So, and her story was she couldn't go visit her daughter and granddaughter who lived in Hong Kong because she couldn't walk. Like she couldn't walk around and get around the airport and stuff like that. So she hadn't seen her daughter or granddaughter for 2 years. She came to me and she's like, pretty much told me to my face, I don't think you're going to help. You know, the only reason I'm here is because the orthopedic surgeon told me to give it a go. And she thought I'd be the failure. 10 weeks later, I had her on a flight to Hong Kong.
That's amazing.
And she was pretty much pain-free. Wow. And she had a flare-up maybe 3 or 4 years after. She came and saw me again. Mm-hmm. I gave her like 3 treatments, went away. Wow. I still see her. And this was probably 8 or 10 years ago. This occurred. And she sent me so many patients because she was like, oh my God, this works. And she had so many friends with similar problems, and she was like, go see Adam, go see Adam, go see Adam. So that's one of my really poignant stories that sticks out. But I have a lot of people similar stories. They go see other practitioners. You know, they try different things. They try exercise. They try, resting. They try, meds. It's really a combination. Like I said, it's not the only thing I do. So I tell people there's 3 ways to get better. Stop doing the things that caused this problem in the first place. Start doing things that will make it stronger, more resilient, more functional. And then third, come see me and we'll do some body work. So that might, because I'm a sports chiropractor, I look at all the joints, I'll look at all the musculoskeletal system, I'll check all the tendons that work with those muscles. I'll look at all the muscles that work with those tendons and make sure everything's working properly. That way you get, when we solve your problem, it's more of a permanent solution rather than
just a Band-Aid.
We're going to calm it down. Mm-hmm. And then when it flares up again, just come back and see. Mm-hmm. A lot of my patients, I give them like a permanent resolution so that they don't have to keep coming back.
Well, amazing. Adam, thank you so much for being on the podcast today. If people want to find you online, what's the best place to look for you?
Yeah, so there's a few ways you can contact me. You can find us at wasabimethod.com. We also have another one. It's wasabimethod.store if you want to purchase a device. I do discovery calls every week. So if anyone wants to jump on a call with us, we usually do them on Fridays. We'll be doing a few more during the week, starting, I think, next week. And yeah, so you can ask any questions. I encourage people, even if you're just someone who wants to find out more, to get it as a service, we welcome you to come on, ask any questions. You can also find practitioners on our website, wasabimethod.com. So we're always adding new practitioners all the time. We will be at several conferences this year as well. So I'm heading out next week. By the time this comes out, it'll probably be over. But CryoCon, which is in Dallas, and then we're going to Health Alliance Experts Disrupt event in Dallas the following week, and then we'll be at the biohacking conference with a nice big booth there. So that'll be fun. You can also find us on Instagram. I do a fair amount of posts on there. It's at wasabi_method. And yeah, we're working on the other ones like the TikTok and the Facebook. And
Yeah.
That's all coming, but we're
right.
getting
Amazing. Awesome. And we're going to link to everything in the show notes as well. And then I just have one last little quick question. How many practitioners do you have worldwide that are already using the Wasabi method? So if someone wants to look for someone in their area, is it pretty easy to find a practitioner, or is it still growing?
Yeah, well, it's still growing. We have, we get sales, regularly, but some people that buy it are non-medical, so you wouldn't go see them.
Right.
But the medical practitioners that get it, it's predominantly in the United States. We don't, like I'm in Australia, but it's in the United States that we have the approvals to sell our device. We're working on approvals for like in Europe and Asia and stuff like that. So that's awesome. That's all coming, but it takes time. And my COO always reminds me when I get frustrated because I'm like, why can't we get this done? And she goes, it takes think how long it takes you to do one little thing. It's like times that by 10, and that's how long it takes to do these things. It's just the admin and you got to jump through all the hoops and stuff. So yeah, but
amazing.
Thank you so much for having me on.
Absolutely. Thank you. I think this is a definitely under talked about, underutilized tool that can be helping so many. So excited to share this with my audience. And if you're at any of the conferences, make sure to stop by and check out Wasabi Method as well.
Awesome. Thank you so much.
Thank you.
Take care.
You too.